the issue with statins is that they are not this wonder drug that they've been sold as. They do have side effects. You know, statins increase the risk of diabetes by as much as 30%. They increase the risk of Alzheimer's. They can have liver issues. They can certainly cause a lot of muscle pain and things like that. So it's not like they are without risk. Now, when you add to that they're being prescribed to basically everybody whose cholesterol tends to be over this arbitrary number, 200. There was never a study saying that 200 is the magic number. And if you're below that, you're okay. And if you're above that, you have a problem. That was totally an arbitrary number that was invented. And there's some good evidence that our ancestors, even 100 years ago, before cholesterol was typically being measured, when people's cholesterol was typically 300. But suddenly they came up with this magic number of 200, which of course makes it for a lot of people who need this statin, right? So it's good for sales. But anyway, so statins will lower cholesterol. And the thought is, well, if you lower cholesterol, you're going to lower the risk of heart disease. Well, as I said, just as many people with, quote, normal cholesterol have heart attacks as people with high cholesterol. So it's not as simple as that. The idea that everybody with a high cholesterol should have cholesterol is really a mistake. Studies will show that for a man or woman who has not already had a heart attack, you need to treat like 67 with a statin in order to prevent one from having a heart attack. That means you're subjecting 66 to the risk of diabetes and Alzheimer's and other things just so that one doesn't have a heart attack. That's not very good odds. That doesn't work for me. It may work for other people, but it's not enough evidence for me. So my approach, again, is addressing the root issues of the problem, which is typical diet, getting rid of those processed foods, and helping people manage their stress through regular exercise, getting a good night's sleep. All those things that our bodies have evolved to need for good health. They haven't stopped working because it happens to be 2022. They worked for our ancestors. They work for us, but we got to do it. And everybody wants a quick fix. They want a pill that they can take, which is going to prevent the problem, so they don't have to go out and exercise or whatever it is, which is so unfortunate because for those of us who do exercise regularly, we don't want to live without exercise. We feel better. We look forward to exercising because it makes us feel good, right? As opposed to, I got to go to the gym. It's like, I get to go to the gym, when I get a good night's sleep and I wake up, I go, wow, I feel good. I'm excited about today, as opposed to, all right, where's the coffee? I gotta go to the office today. All those things that just are depleting mentally and physically are not necessary if you just, what I call is read the instruction book, follow the instruction book, the way our ancestors lived.